Well, good afternoon, everyone. If I can bring this part of the annual review, the public session, to order. You will see we have a signer here, and can I welcome you all to this public session of the annual review of the National Waiting Times Centre. I've spent this morning meeting with the local NHS staff and patients, and had a walk round the hospital, which this is second or third visit to the Golden Jubilee, and I'm immensely impressed by it. In this part of the review, we'll have a short video presentation by the board chair, Jean, and covering the key areas of the Scottish Government's three quality ambitions of person-centred, safe and effective care. And this will be followed by a question and answer session. We have some questions that have come in already through social media, but this part can be questions for the Waiting Times Centre Board, commonly known as the Golden Jubilee Foundation, or any questions, further questions that you may want to ask the board or direct to me, and we'll try and answer them. Of course, it's not appropriate that there are specific patient-centred, patient-specific issues about individuals raised at the meeting here. That wouldn't be appropriate in a public session. So with me today, I have Paul Gray on my left, the Director General for Health and Social Care and Chief Executive of NHS Scotland, and John Conahan, who's NHS Chief Operating Officer, and Margaret Duncan, Scottish Government Performance Manager for the board. So I'm now going to hand over to Jean Freeman, Chair of the Golden Jubilee Foundation.
On my far left is Jill Young, who is our Chief Executive. Immediately next to me, Mike Higgins, who is our Medical Director, and a lovely bevy behind me, Julie Carter, our Director of Finance, Jane Christie Flight, two sub-names there, making Janice work for her money, who is our Employee Director, and Anne-Marie Kavanagh, our Director of Nursing. So, as the Minister said, this is our annual review. It's our opportunity to tell you and to tell Scottish Government what we've been doing over the year. The year in question is 2014-2015. And also to take questions from the Minister and government colleagues, from yourselves, and as the Minister said, we've got some questions that have come into us from social media. As a national resource for the health service in Scotland, we don't have a local community, if you like, so we actively try to seek out questions and feedback and comments about how we're doing from across Scotland, because across Scotland is the population that we serve. To begin the review, can I introduce to you a short video? But before I do that, can I also thank, on behalf of myself and the board, the Minister for taking so much time this morning to look around the hospital, meet our clinicians and some of our patients, speak with our partnership forum, and also the meeting we've just had with some of our patients and volunteers. And we really do appreciate, in a very busy diary, our Minister taking that amount of time to get at least a flavour of what happens here in this foundation. Because it's not simply the hospital, of course, it is this innovation centre, it is the research work that we conduct, and it is our conference hotel and conference centre that is just outside these doors. To give you a flavour then of what we've been doing over that year in question, I'm going to play now a short video. It's about 10 minutes. It tells you what we've been doing, but equally important, what we've been doing to meet and in many cases exceed the targets that government set us when we last had our previous annual review. Thank you very much. I hope you found that useful. I think everyone should have as well on their seat a copy of this, which is simply our performance over 14-15 at a glance and some of the key elements. And before I hand over to the Minister, can I just take this opportunity to say that in the recent Stonewall Workplace Index that was published earlier this month, I'm beyond proud to say that Golden Jubilee is #1 in the UK in the health sector and has moved up to number 29 overall in the total employers in the United Kingdom. So a huge accolade to our staff and to all those who work so hard to get us to those places. I'd now like to hand over to the Minister for any questions that she may have for myself or my colleagues.
Okay, shall we just go straight on to the ones that have come in?
Surely.
Jean, do you want me to read them out?
Yeah.
Okay, so we've got one from Ali Smart through Facebook, which says, I was reading about a new valve that was being used in the hospital for people with emphysema. Why is it not more widely available?
Yes, I'll it's one of the new treatments that we are investigating in the thoracic service. The idea is that patients who have a disease called emphysema, where parts of the lung become overexpanded and inefficient, and what the new valve does is it restricts the air supply to these areas and allows them to collapse. Now at the moment it's being evaluated on an individual patient basis. We've had some very good individual results, but as with any new treatment we have to do a very careful, formal, overall evaluation before we can decide whether this would be a suitable treatment to roll out for this condition.
Does anybody else know or want to comment about that particular bit? No? Okay. And then we have one also through Facebook from Cassie McIntosh. You provide such a specialist service. How do you plan to develop this in the future?
Yes, we do, and we heard in previous meetings of the expansion announcement made just before Christmas by government for us to look to plan and build a new elective centre here in this site. So that's one area. Although the centre will be for elective and diagnostic and imaging, that will allow us to free up capacity in the main part of the hospital to do more of the specialist work. In addition to that, I was very privileged to be invited to be a part of the government group looking at Scotland's national clinical strategy, which is looking at a bit about how specialist service should be delivered across the whole of Scotland. And we've taken this work and we've now started internal work here in our board about how we can align how we're taking our board work forward in terms of heart and lung orthopaedics, ophthalmology, cardiology, in line with the national Scottish work.
Okay, anyone else got a follow-up question on that or anything? No, okay. The next one is from Adam Carell, and he says, can you provide any more information on the expansion announcement, please? I think, John, that's for you.
Thank you, Minister. The First Minister announced late last year that she was laying aside a £200 million development fund that would cover the creation of 6 new elective centres across Scotland based in 5 wards, and obviously one being based here, which is in the Golden Jubilee, which would serve, didn't serve the rest of Scotland, but particularly serve in that new expansion the growing needs of the west of Scotland particularly. The Golden Jubilee, I was asking when we had bought the Golden Jubilee, I think it was the 2nd of June 2002 or thereabouts, so that was an important day. And on that day we were putting through about 1,500 patients per annum to the Golden Jubilee, and you can see the expansion that's taken place year on year since then. So we've now reached the situation, particularly in the Golden Jubilee, where space is now getting tight. Okay? And it's now appropriate to consider the next 20 years. The modelling that has been done on that inside the Golden Jubilee looks out to 2037, so it truly is a kind of long-term development plan for the site and for the service. We will shortly start to embark on serious planning connected with that. And I think the Golden Jubilee can help us not just in terms of what's going to happen on this site, but the vision for all the other sites in Scotland. This is a tremendous centre here for innovation, research, a growing reputation with new techniques, like for instance enhanced recovery, which has been rolling out across the rest of Scotland in orthopaedics now. So it's the second time. We've got a great vision ahead for that and for the Golden Jubilee, and that's all I can say about that right now. But the plan is that we would expect that this new facility will be open within the period 2021, after we did the tendering of the building and the recruitment for it.
Is Adam here? No. Okay. The next one is really more of a comment, but I should read it out anyway. Is there some way or somewhere that I can post my complete and utter satisfaction with my stay in the Golden Jubilee? I would love it to be included in any annual review. My bilateral hip replacement has totally changed my life entirely for the better. I'm happy to wax lyrical on this wherever and whenever it might be helpful. And I didn't care to say that. But that's just indicative, I think, of many of the comments that have come across today in the time that I have been here. Are there any more questions from the audience?
My mum was a patient here twice, 2005, 2012. Always like to start with just recording thanks as well for the very successful bypass she had in 2005, and the care that she received here, for a procedure she actually had to go to Belfast for, the Golden Jubilee before and after provided the same excellent care for her. Since Mum's TAVI procedure over in Belfast, I've kept a keen interest in the development of TAVI in Scotland. We were disappointed that Mum couldn't get TAVI here in Scotland, but although she wasn't one of the first to get TAVI, she certainly was one of the last that had to leave Scotland. I've been reading quite a lot of literature from the Scottish Government, etc., a lot of research, and at the moment it seems that about 40% of the total referrals to the TAVI Centre in Edinburgh are from here, the west of Scotland. I include the Glasgow region and the Ayrshire and Arran region, so geographically about 40% of referrals are from the west of Scotland. Attached to the letter that Chief Medical Officer sent out last year, when she was a bit concerned about the referral patterns across Scotland, there actually was a patient pathway attached to that letter, and it explains, as far as I understand it, explains the pathway for the patients who eventually have TAVI from the Edinburgh. And it seems to me that the patients are referred from the local cardiac centre. They are referred through to Edinburgh for an outpatient appointment with cardiac thoracic surgeons. They are then back home to wait. They then refer back to ERI for a full assessment. Then they're back home to wait. Then they're back to the Edinburgh Royal Infirmary with their families to discuss the various options, etc. If there's one thing I remember about Mum's severe aortic stenosis, was that it's notoriously progressive. At the risk of sounding flippant, that doesn't seem like a pathway for me. That's a green mile, Minister. These people are dying, and in some cases they're having round trips of 300 or 400 miles to go back and forward, and with less than half of the referrals actually successfully being approved for TAVI, I'm not surprised. I think there might be a real danger that this travelling, for the 40% of people in Scotland with severe aortic stenosis, I think this travelling might actually be impacting their health, so that someone who's referred there could be a candidate, but by the time they've travelled this pathway, they are deemed unsuitable. And some of the, I've kept up to date with a lot of the data from the Scottish Health Directorate, but one of the reasons now for people being deemed unsuitable for TAVI, and it's just became a recent reason, it wasn't a reason in the first 2 years, one of the reasons is that they actually don't have severe aortic stenosis. I'm certainly not a clinician, I don't have any medical background at all. I think it's inconceivable that someone who travels that pathway can be told they don't actually have severe aortic stenosis. Someone who has been monitored and assessed by world-class cardiologists, cardiothoracic surgeons, to eventually be told at the end of that process you don't actually have severe aortic stenosis. It really doesn't make sense to me. To be quite frank, I think the TAVI Centre are running out of excuses to refuse people TAVI in Edinburgh. Reading the final TAVI report, the one in 2010, there were certain recommendations in that, but there was a very troubling statement, I think, in the conclusion at the end, and it said that the TAVI group were not uncomfortable with the idea of capping numbers for a Scottish TAVI service. Can I ask the Scottish Government, are the numbers in the Edinburgh TAVI Centre being capped? And if they are, Minister, will you contact the National Planning Forum, bypass the TAVI review group, because the TAVI clinical review group has been disbanded, and ask them either to extend the TAVI service here to the west of Scotland, to relocate the TAVI service here to the west of Scotland, or follow option B2 of the final TAVI report, which says that Scotland could have one TAVI service with one TAVI team over 2 sites. Thank you.
Okay, thank you very much. You didn't give us your name, sir. So.
Oh, sorry, it's Brian Bradley.
Okay, right. Thanks very much. Right, I think it's clear that I can't make any comment on clinical decisions from highly specialised consultants and people in the field. Secondly, you know, we are talking about a very specialist service, so regrettably, you know, people are going to have to travel. You're not going to be able to have something as specialist as that in every single health board area in a country size of Scotland. Thirdly, and before I hand over to people who know more about this, is that currently, yes, the service is at ERI. We know that the numbers being treated at ERI have exceeded the numbers that we expected. I am not aware that it's capped, but I'll leave that to Paul. So the service is under review. It will be part of our whole national clinical strategy, which is being devised at the moment, and will be part of that. But for more detail on that, I'm going to hand over to Paul.
Well, thank you. Thank you very much, Ryan. I appreciate your positive comments, and actually I'm very glad to have your challenge as well, because I think it's important that we hear about the experience, the real lived experiences of people who are using our services. As Ms. Watt says, there's been further review work done very recently, due to report shortly, but 3 things I want to say. First of all, I think, subject to any points that Mike may want to make, we'll take up your point on the specifics with the Chief Medical Officer when we get back, just to ensure that there isn't anything there that might be a cause for concern. As Ms. Watt says, I'm not going to comment on individual clinical decisions. Secondly, the clinical strategy, the national clinical strategy, we propose, subject to ministerial clearance, to publish next month, and I think that will set an important framework for how we deliver services looking ahead, to make sure that people get the best care at the right point in time and as close to the point of need as we can. But there's very clear evidence that specialisation greatly helps the patients in terms of the outcomes that they receive. So certainly dispersing an important service like TAVI across Scotland would not be what we want to do, but I'm absolutely clear that if there is a need for 2 centres, then we will address that. There's no inhibition to addressing that point. John, do you want to add anything to what I've said?
No, I think the only thing I would answer is I think you made an important point about the administration of this, and from the patient's perspective, particularly those who are not inside NHS Lothian who have to travel a bit. You sparked a thought in my mind that having an outpatient consultation and coming back from the assessment and having multiple visits, we've tried to move in Scotland to having a system of one-stop shops. So you attend, you have your appointment, you have your diagnostics, etc., all on the same day, and that helps to cut down time on that patient pathway. Now, I can't say if that's appropriate for patients going through TAVI, but it's something that we can certainly put as a question, okay, to see if we can speed up that pathway.
Okay, Mike, does Mike want to comment on that?
Yeah, I just following on from Claude's comments earlier, I think we've kept in very close contact with the Edinburgh team. We've worked with our clinicians and I've worked with the Edinburgh team, and we have tried to maintain a clinical skill base in the procedure. So that should it be rolled out to more than one centre, if that was the correct decision, then we would be in a position to engage with that. And I have to say, I do have great respect clinically for the Edinburgh team and for the results in the surgery that they've delivered. And we would hope to continue working closely together, irrespective of what the services delivered.
And it's certainly not in our long-term thinking that people should be coming multiple times before they actually get their operation. I mean, for example, I was learning this morning about, in terms of hip replacements, where people from Shetland are actually speaking with their consultant here via video conference. They have the x-rays, everybody can see the x-rays online now, so that people don't need to come to physically where they're going to have the operation until actually they're going to have that operation. Everything pre-diagnostic and pre-assessments can be done where they are at their local hospital via video conference. Now that's just one area, but it takes time to make sure that the equipment and the video conferencing and all the diagnostics that you require are available for everybody in the team before you can perhaps roll it out into other areas. But that's the direction of travel, rather than having people coming multiple times to somewhere which is quite far away from where they live. Anyone else got anything like that?
Just to assure the Minister that we are in continuous engagement with the Edinburgh team. The Edinburgh team, the clinicians, were here last Friday sharing with us their excellent clinical outcome, which we are partner of it, and we champion this clinical outcome results. We also looked at the process of referral and where the service is going, and we will share these kind of figures and the results with everyone. And I think there appears to be direction that the volume is increasing. Edinburgh at present moment in time is coping, but I think there is a projected proliferation for legitimate patients who will require that, and we will welcome to be partner in reviewing the process to ensure that patients who are in need will have it wherever they are there. And let's also add that there is a very important aspect related to that structural heart disease, which is basically part of it, TAVI, is a very well-established area for research and innovation, and we would like the Golden Jubilee to take its place on that field in the foreseeable future, and we welcome very much the support of the government in this place.
Okay, is that all right, Mr. Bradley?
Yes, I think, can I just add one more statistic? Just that I know that Mr. Gray had said that it was overtaking its expectations, the TAVI centre, which was 50 per year, 50 TAVI operations per year. I just wanted to say that actually the rates per million in England are 25, so that would be in Scotland an expectation of 125. In France it's actually 40, and in Germany it is 60 people per million. I've just always been curious as to where that target came from, because Scotland shows a rate per million of 10 people per million. That's nowhere near the English target, and it is far from the French and German targets. I was just wondering if you knew at all where that rate came from, 10 per million.
Thank you. That's helpful further elucidation of the point. I think what I would like to do is, as I said, to take this into discussion with the Chief Medical Officer, and what we should do, Minister, if you're content, is perhaps include with the letter that we normally write to the board following an annual review, a commentary on the TAVI service and where we are and these important points that have been raised.
Right, I've got one more question here by email from Sarah O'Neill. On a few occasions I've had my ambulance cancelled by the Scottish Ambulance Service. As a patient who has undergone 2 hip replacements in the last year, I've relied heavily on booking an ambulance to take me to hospital appointments at the Golden Jubilee as I'm travelling from Coatbridge. Taxi costs around £40 to £50. I have been informed all the policies and online systems have recently been upgraded, but my question is, when will the Scottish Ambulance Service spend the money on providing more ambulances and more staff, as it seems to be more of an issue? I think, is Sarah O'Neill here? No, okay. It's probably better, since this is a specific case, that it's followed up by you, John, offline. But I can say, I mean, people, that there is obviously a difference between the patient transport service and the ambulance service that comes out in an emergency, and we are working with the ambulance service to make sure that there's high quality provision of care, both for patients who need to be transported to hospitals in emergency situations, but also in terms of the patient transport service. And we have announced increased funding of 3.6 million in the financial year 16-17 for the Scottish Ambulance Service to recruit and train more staff. And obviously that will then help increase the available resources both for the emergency service and the patient transport service. I should say, of course, that in terms of patient transport, in many parts of the country, an awful lot of that is done by the voluntary sector, for which we're all very grateful, and there are a lot of people who are in the retirement who very willingly undertake that service. So that helps enhance the service as well. But John, I don't know if you want to say anything more.
I think given decisions on patient transport are made at an individual level in terms of assessment of need, etc., I think it would be useful if on Monday we can contact the person by email, get the circumstances, liaise with the ambulance service, and then provide a direct answer back to that person. We'll try and do that as swiftly as possible.
Okay, does anyone else have any further questions? No? Okay, well, can I thank everybody for coming. I will this afternoon be meeting the board in private, and we'll have some detailed discussions about performance and what might be in the ministerial letter. That sets out the main points and any actions that have been discussed during the day. That will be published on the board's website along with the board's detailed self-assessment documents. That happens in due course. I'd also like to take this opportunity to thank Jean, who will shortly be stepping down as chair of the board next month. I was absolutely astounded as we were walking around this morning how many people, not just staff but patients, know Jean personally, and she's obviously taken great steps to really get under the skin of the National Waiting Time Centre and know it inside out. Jean's led the board in a unique new vision for NHS governance and quality. There have been a number of successful expansions, and she's embedded very much a person-centred approach to everything the foundation undertakes. So Jean will be a significant loss to the National Waiting Time Centre. It says here in my notes to NHS Scotland, but knowing where Jean hopes to be after May this year, and I'm sure she will be, I don't think it's going to be a loss to NHS Scotland. So I look forward to welcoming you, Jean, and if I get back to the Scottish Parliament, I'm sure you'll be a great asset to us there.
Thank you very much, Minister. I'm not actually going to say anything at all about leaving because I'll just start reading, except to say that this is the proudest thing that I do. Can I thank you and your colleagues again for taking the time to be with us? Can I thank all of you for taking the time to come along and be part of our public session? And finally, on your behalf, can I also thank Janice for being very patient with us and signing so well. Thank you very much. I'm sure my colleagues will see all of you again next year. Thank you.